Junctions in brain. Brain has tight junctions that form the blood-brain barrier along with astrocytes. Food processes except for the OVLT organum vasculosum lamina terminalis. Osmotic sensing region that has the gap junctions and area post-trema that has the chemoreceptor trigger zone. This forms a route for chemotherapeutic agents to enter brain and cause nausea and vomiting. Cerebral perfusion is primarily driven by PCO2. PO2 also modulates perfusion in severe hypoxia. High PCO2 causes cerebral vasodilation. So when you hyperventilate, you wash out CO2 causing cerebral vasoconstriction and person passes out. Watershed areas. Watershed area is the area most sensitive to hypoxia as they receive blood supply for the most distal branches of two arteries with limited collateral vascularity. In brain, it is ACA, MCA, PCA boundary areas. Neurons most vulnerable to hypoxic ischemic insults include Purkinje cells of the cerebellum and pyramidal cells of the hippocampus and neocortex, zone 3, 5, 6. Hypothalamus and nucleus controls hunger, thirst, temperature, sexual urges, automatic functions, and helps maintain homeostasis. Anterior nucleus is parasympathetic in nature and helps cool down the body. Posterior nucleus, it is sympathetic in nature and heats up the body. Acetaminophen inhibits this area and exerts its main function. Aspirin inhibits PGE2 that causes fever by upregulating the COX receptor of posterior hypothalamus. Preoptic nucleus releases GnRH. Failure of GnRH producing neurons to migrate from olfactory pituitary causes Kallmann syndrome. Supraoptic and paraventricular nuclei synthesizes ADH and oxytocin, which are carried by neurophysins down the axons to the posterior pituitary, where these hormones are stored and released. Ventromedial nucleus is stimulated by leptin and controls satiety. Destruction to this nucleus leads to lack of satiety. As a result, the person keeps eating as he never feels full, and this causes obesity. Finally, leads to insulin resistance and type 2 diabetes mellitus and obstructive sleep apnea. It is damaged in craniopharyngioma and Prader-Willi syndrome. Prader-Willi is when genes are silenced or imprinted. Lateral nucleus normally causes hunger, so when lateral nucleus is damaged, it leads to lack of hunger. As a result, the person is very thin. Stimulated by ghrelin and inhibited by leptin. Suprachiasmatic nuclei, it controls sleep and regulates circadian rhythm via orexin pathway and keeps you awake. It is stimulated by light. Sleep physiology controlled by orexin pathway via suprachiasmatic nuclei (SCN). Like the environmental factor is the most important stimuli of SCN. As we age, there is decrease in REM and slow wave sleep, increased sleep onset latency, and more early morning awakenings. Alcohol, benzodiazepine, and barbiturates are associated with decreased REM sleep and delta wave sleep. REM latency. Time to enter REM sleep after falling asleep. Drug of choice to treat depression and premature ejaculations is SSRI. Sympathetic nervous system causes ejaculation, while parasympathetic nervous system causes erections. In all patients, SSRIs can cause diabetes insipidus. Adverse effects cause sexual dysfunction. If that's the case, switch to bupropion. DNRI, dopamine norepinephrine reuptake inhibitor. Thalamus. Thalamus is a major relay for all cranial nerves and ascending sensory information except olfaction. Touch, pain, temperature are under the control of thalamus. Nucleus of thalamus. Nucleus of thalamus. Thalamic strokes occur most commonly in this nucleus and is a pure sensory stroke with loss of touch, pain, temperature. Central post-stroke pain syndrome, neuropathic pain due to thalamic lesions, initial paresthesis followed in weeks to months by allodynia, in which ordinarily painless stimuli causes pain on the contralateral side, occurs in stroke patients during recovery phase. Dopaminergic pathways, D2 in brain and D1 in kidneys. Mesocortical pathway, it is associated with negative symptoms, low mood or schizophrenia like anergia, apathy, lack of social skills, and emotional disconnect. Antipsychotics cannot treat the symptoms as they lower dopamine, which lowers the mood. Negative symptoms are not treatable easily, as treating them elevates mood, triggering psychosis. Mesolimbic pathway. Positive symptoms of schizophrenia like delusions, hallucinations are generated here. Therapeutic target of antipsychotic drugs is on this pathway by inhibition of D2 receptors. Nigrostriatal pathway. This is a major dopaminergic pathway in brain. It controls movement. Low dopamine secretion in this pathway leads to Parkinson's. Tuberoinfundibular pathway is responsible for milk let down reflex, as dopamine and prolactin are inversely proportional. Parkinson's disease dementia is when frequent falls in an elderly should raise the suspicion of Parkinson's. As the patients are stiff, they take falls. Evaluate a fall in elderly by the get up and go test when the patient is asked to stand and walk. Loss of dopaminergic neurons or depigmentation of substantia nigra pars compacta. MPTP, a contaminant in illegal drugs, is metabolized to MPP+, which is toxic to substantia nigra and is proposed to trigger Parkinson's disease. Shy-Drager syndrome, multiple systems atrophy, as has Parkinsonism, autonomic dysfunction, orthostatic erectile dysfunction, and widespread neurological symptoms. Levodopa long-term use leads to lack of response or an unpredictable drug response, so give drug holiday in the middle. Carbidopa blocks peripheral conversion of L-dopa to dopamine by inhibiting dopa decarboxylase. Treat tremors with anticholinergic medication like benztropine or first generation antihistamine like trihexyphenidyl, as they have anticholinergic actions.